Hello, this is Dr. John Luther. I'm a retired family doctor. I'm going to tell you today about carpal tunnel syndrome. It's a problem where a very important nerve in the body becomes compressed. I'll show you the model of the hand. And we'll just zoom in on that. There we go. We can see the little yellow nerve here. See the nerve there? It's yellow. Here, yellow again. This goes under a fibrous band. This fibrous band can compress a nerve, and that is called a nerve entrapment syndrome. Median nerve supplies some of the motor power and the grip in this area. It also helps to provide sensation, feeling. So if you lose this, you can see this is one of the most important nerves in the body. The fibrous band here is actually a little bit further down. The main symptoms are things like numbness, pins and needles, sometimes a bit of pain in this area. Patient tends to drop things. The grip is a bit weak. Ask the patient to grab you, it's a little bit weak. This muscle tends to waste away. Instead of being a bulging round muscle, it tends to go flat. Notice that if it's on one hand but not the other hand. This fifth digit here is not involved. The patient doesn't usually notice that, but if you touch here, the patient will say, "Oh, I can't feel very well my thumb, but I can actually feel it here." So you can educate the patient there. The patient tends to shake the hand in the middle of the night and say, "Oh, pins and needles are driving me crazy." The causes of carpal tunnel syndrome, there isn't always a cause, but things like that can make the hand swell include things like obesity, pregnancy, hands swollen with arthritis like rheumatoid arthritis. Heavy manual labor, yeah, difficult if you're really having to do a lot of labor. Low thyroid hormone can cause it. Any fractures that have occurred in this area could be displaced and compress the nerve from behind. And once again, we don't always know what the cause is. Some ways to treat it, if it doesn't go away, put a splint on, the splint here, and keep the wrist from moving. The best ones, you can get them from pharmacies. If you want a more expensive one, you can get them from medical supply stores. Look up medical supply store in Yellow Pages. You can phone ahead to see whether they can have one for you and what the prices might be. If that doesn't work after a number of weeks, then you can look at surgical approaches. So you need to cut this fibrous band. Some people will cut here, but that leaves a scar in your palm, and as you're recovering, it's hard to wash your hand and use your hand. If you use a keyhole procedure here while you're cutting, then the recovery time is quicker, and you won't have so much sensitivity in the palm. After a couple of weeks, you can wash your hand. General recovery time is 4 to 6 weeks. Let's look at the instrument that can be used. We're looking here, there's two tongs. Here's a tong here that's dull. Here's another tong here that is quite dull. Dull here, dull there. Here's the only sharp part, sharp cutting blade here, semicircular blade, and that will cut the fibrous band. There's the handle. This, of course, is much bigger than the instrument's about 1/5 this size. So we're looking at the instrument here. Let's get a bit closer. There's the nerve there. There's a fibrous band, and a tong here and a tong there. One tong to protect the nerve, one tong to protect the skin, and the cutting blade that cuts the fibrous band. There's a band there, and it cuts here. So we approach from here. The tongue below is protecting the nerve, and the tongue above is under the skin, and you just cut through there. The surgeon is watching that nerve very closely. He doesn't want to cut the nerve. Surgeons who do this are neurosurgeons, especially trained orthopedic surgeons, and plastic surgeons. Your family doctor can refer you to a specialist, and just remember, you'll be quicker with the keyhole procedure, so ask your family doctor if he knows the specialist can do this for you. This is Dr. John Luther, over and out on carpal tunnel syndrome.